good morning, Neha. It's very exciting to have you here to talk to us about our project interventions through our collaboration with Samhita. So, with me here today, it's a bright morning. So, you want to introduce yourself, Neha?
I'm a lawyer by profession. I grew up in Delhi, and then right after school, I came over to Bangalore actually, and I did my law degree from National Law School, Bangalore. And then I followed it up with a master's degree, and sort of went back to Delhi, and I actually was in private practice for almost 6 years. And then I moved in-house to an Indian company for a few years. I actually did financing. Um, and then I joined GE in 2017, very much as a lawyer. And I was part of GE's gas business then. And then eventually moved on to GE's steam power business. And then sometime in COVID in 2020, I got a call saying, would you consider moving to healthcare? But it's a Bangalore-based role. So moved to Bangalore and started working in healthcare just after the second wave. So started working in healthcare in 2020, but then moved with my family to Bangalore in 2021. And then I think shortly after moving, there was an opportunity to take on an additional portfolio of CSR. I was already familiar with the board rhythms and of course managing the board as the general counsel of the company. And then the person who was looking after CSR in the executive management left, and then I sort of just put my hand up actually. I wasn't asked. So before I was asked, I put my hand up, and it seemed that people were anyways thinking about the same direction. And then from 2021 onwards, started doing CSR as well, with the help of our CSR manager, who's Sandra and has been around for doing this for far longer than I have.
Great, nice. So, what interested me was, you're a general counsel, and how did you get into CSR? It's kind of like a different. Um,
Yeah.
game.
I keep getting asked that question. A lot of general counsels I meet, a lot of law firm, colleagues I meet. Everyone is actually more interested in the CSR work that I do than rather than talking about law, right? When I meet them socially. But I think what people forget is that, fundamentally, legal studies is also about, studying different aspects of society, right? So I actually did a BA LLB. I didn't do a LLB. So my formative years of education were like a cross junction between doing economics and sociology and political science, because without an understanding of society at large, you can't really be a good lawyer, right? So while of course subsequent years of my career have always been about corporate law, but there's always been a strong interest in doing something apart from just something for yourself, or for your employer, something that has sort of a larger impact. So that was really the driver, right? And then there was a secondary driver, which was that, see, I was already involved as general counsel. As you know, GCs very often are part of CSR committees just to guide the board through. And CSR, unfortunately, has been a lot about compliance, because I used to joke that every January there is a new FAQ, and then we're like scrambling between January and March. So I was already familiar with the work, more in terms of a reviewer, right? But what really interested me was that, as a lawyer, you very often have a mindset that over the years, you don't realize this, becomes about protecting the company or protecting a situation, or you're always trying to be a risk mitigant,
Right.
so either you go around shouting about risk or you mitigate risk. That's really a lot of what the lawyers do. We unfortunately don't get to be positively creative, right? And I just felt like that would open up a new part of my brain. Like, how do you take a budget, and how do you say, what can I do with this amount of money? Even though you could do it in, you could design a CSR program in so many different ways, right? Why should you do it in one particular way? And what is the impact that can come from that, right?
Right.
So that positive creativity, I thought would be transformational for me. for my brain, right? So I think it was these two parts of it that I said, okay, I'm going to put my hand up for it, even though I joined and I think I went on maternity leave like 4 months later. So it was a little bit of a stop start, but I think, I mean, I can't say all I can say is I've learned a lot, right? I can't say I know a lot, but I've learned a lot in the
Great.
last 2 years or so.
Very interesting. But then, when you look at the compliance side of things, because you come from the legal experience, so do you think there are barriers, challenges to working with NGOs when it comes to implementation, execution of some of the projects? So, how do you deal with those challenges?
So, we actually, before we I think when somebody approaches us, we very much first look at what is the idea, right? And we ask ourselves a couple of questions on the idea, and then we actually go down to, does the party have all of the requirements and the certificates and all of that.
Okay.
And I think because CSR has been around for at least half a decade now, right? A lot of the players in the market have what it takes on paper. So you will not come across a partner who comes to us, or when we come to CGF
Right,
to do a
right.
diligence, where on paper there is any issue. It is just that when you start working with partners, that you realize that all of them have strengths and all of them have weaknesses, right?
Right.
And now with some trial and error, I think we have realized that there are some projects which are just better implemented with certain partners, maybe because of the nature of the project, but also because of the geography, right?
Right.
So some partners are just stronger in certain states as opposed to other states. Some partners, for example, may be great at execution but do not have a great government connect. So you need to supplement their efforts by getting in that government connect, right?
Right.
And then there are some partners who are wonderful, they are visionary, but they probably don't have the experience. What do we bring? Because we I think we understand our strengths and what we can't do, and very often it's great to have partners who at least supplement some of our weaknesses, right? So if I'm weak in something as a company, can you bring your strength and can we run a good program? So that fundamentally is the question that we try.
So you
and ask
believe in a
ourselves.
co-creating
Absolutely.
model. Okay.
Absolutely, right? We have Sandra, who's a CSR manager, but we do have people drawn from different functions of the company. So we actually have this internal committee. I would say employee volunteering is something that G has done for very, very long. It goes way beyond what CSR, in terms of the CSR budget and, government mandated requirements. This actually is a smaller committee that came into place quite naturally and organically, because we realized we need these people to weigh in. If you need a finance guy to clear the the invoices, you need somebody from legal, you need the company secretary. Why don't we also get them in right in the front when we are designing programs, right? Because all of them come from different parts of life, different parts of the country, they bring different perspectives, they again have different strengths. So we actually, when we go to that committee, we don't say, okay, we have decided, and can you go clear that invoice, and can you go do this? We actually bring proposals to them and we try and get their inputs around what do you think is better, which direction should we go.
So there's a lot of high touch engagement.
Yeah, there's a lot of engagement from all of these people. I never think of CSR as a program that I am running, as a CXO, or say Sandra is running as a legal manager, and we don't have a team beyond that. But this is our team, this is kind of our extended team, and we run it with all of these guys. We also, to your point on volunteering, mixed with CSR before COVID. Now, obviously, during COVID, it was really difficult to get people out there, to a primary healthcare center or an Anganwadi or whatever. Post that, we have had a couple of events, and efforts made to get employees back into the CSR program, because it's amazing, when you go out there and you talk to employees about CSR, you would be amazed at how many people are interested, right? People don't even really think of it as, oh, this is a mandate, I have to do it, so somebody's doing it, right? There's a lot of pride, there's a lot of belonging. People want to spend time, they want to bring, they just want to do something, right? And if you can give them that structure, right, they are more than willing. Now, I now think that we are entering into this sort of new phase, kind of looking at it in two ways, right? One, we will have some CSR where, due to the nature of the programs, perhaps we will not be able to really get employees into those programs. We will then have some CSR where we will involve employees. But there we are also trying to design a completely separate employee volunteering program where the budgets will be completely separate from the
Okay.
mandated CSR spend. But they will just involve, going out there, finding a cause, and doing something that employees enjoy doing, right?
So your focus will always be health, right? Because you come from that priority.
Right. So, we've thought about this so much, and you'd appreciate, like I was just telling you, GE Healthcare South Asia actually consists of 3 entities, out of which 2 are joint ventures. One is a joint venture with Wipro, which is WiproGE Healthcare. The second is GE Bell, which is with Bharat Electronics. CSR is a topic that gets all our board members very animated, right? Everybody has ideas, thoughts. Everybody wants to move it in a certain direction, X or Y. And so it has taken a lot of, while you would think that for a healthcare company, it should be health, there was a lot of active debate and continues to be as to whether it should be just healthcare. Should it be healthcare with some education? Should we be doing stuff for healthcare, but maybe in and around Bangalore, because so much of the company is, identifies with Bangalore. Our roots are so deep in the city. Or should we be doing, work in certain states where we feel healthcare indicators are very low, right? So after I think a lot of debate, the consensus seems to be that it should be healthcare, because even as a company, right, we so much of our aims and objectives as a company are about precision healthcare, which is essentially about making sure that you as an individual, when you walk into the hospital as a patient, you get personalized healthcare, right? And the second aspect of that is accessibility to healthcare, especially in a country like India, right? Or even South Asia, where all of these entities operate. Accessibility to healthcare, just is such a huge challenge, right? And there is just so much you can do. So while we still have some great programs which say focus on education, like the Born Learning program.
Also doing skill training, right? With
Yeah. So while we have, like I was just giving an example of Born Learning, but Born Learning also has a very important aspect of nutrition, right? That when you have an Anganwadi, right, and you have mothers and fathers coming and they sort of develop a close connect with that Anganwadi, you also tell them about, don't give your child a packet of kurkure for breakfast, right? This is what you can give them.
Nutrition.
So there are aspects of nutrition. There's also an effort to keep the children, on track with their vaccination programs, right? So all of this also has that sort of healthcare connect to it. And, sort of coming back to skill building, so we have been running a long-standing program with Pratham, right? That's because this is the way we see healthcare. So we try and do programs mainly around, I would say, 3 aspects. One is capacity building. Now, capacity building could be physical infrastructure, or it could be the capability building of doctors, ASHA workers, nurses, and just like general duty assistants, which is what the Pratham program is all about. The second aspect of this is really, patient support programs. So where like for example, we run a great program with Navya. We've been doing it for, a long time now, which is about onco telehealth consulting, right? And really the third one, which sort of came, it was a pivot during COVID. We still try and follow up when we feel like a lot of help is required, is around disaster relief, right? Obviously something happens and you want to help in that, sort of relief effort. So we, for example, during the COVID time, so much of our efforts were focused around different aspects of, COVID detection and helping with equipment, because obviously GE manufactures a lot of ventilators, right? So we actually had ventilators diverted from other parts of the world and donated to hospitals in Bangalore during that point in time. We did a lot of sort of ICU sort of formation. So we donated ICU beds, motorized beds to major hospitals in Karnataka, to hospitals in Delhi. So, we keep thinking about, how to help when something big happens. First try and, through you guys, through our other partners, try and see whether help is actually needed or there's already enough help pouring in. So it is also about, will the help that we do, is it required, will it be effective at that point in time? But broadly, those are the 3 pivots that we try and see, do programs fit into one of these or not.
With your support, I think we are also working in very difficult terrains such as Assam, which is like you have to take a boat and
Yes,
reach the
yes,
destination.
yes, yes.
So, are there any challenges that you feel can be addressed if we were to jointly work together and mitigate these?
Yeah,
In terms of even infrastructure, I heard from Sandra that it's very difficult for the health centers to work because there isn't proper access to roads even to reach
yeah,
that place.
yeah, yeah.
So, is there a thinking to work on infrastructure and strengthen that bit a bit, and then look at interventions
Yeah.
later?
So, we actually supported some, is it 7 or maybe 8 PHCs in Assam. We continue to still on the last leg of, completing a few of them. It's taken multiple years to get that project done. We've also started the effort of supporting some PHCs in and around Bangalore. The idea is to also move to northern Karnataka.
Is it because it's rural and there is no
It's
access?
also because a lot of our employee base is drawn from
Okay.
Karnataka, and we have a lot of emotional connect where, I have had employees walk up to me and said that, in northern Karnataka, for a decent hospital, I have to go 200 kilometers away, right? So we felt like we've always focused on urban CSR, and perhaps not a lot of people are looking at, these sort of rural parts of the state. And even though it's going to be tough implementing, we are fully aware of all of the challenges. We thought that let us start with our backyard, right? We have, like, for example, so many of our factory workers, come from that part of the state, right? And we hear these very emotional stories. So we wanted to speak to that as well. But, coming back to your question on infrastructure, when we started with these projects, it was more request based thing. So perhaps because we were a healthcare company, we would have somebody, because, like, for example, in Assam, we have service people, right? Our machines get sold in big hospitals. These guys go service machines. So we used to get these requests that, can you support this primary health care center or XYZ, right? And so we would take them up on a case to case basis. And perhaps, this is one of the great lessons learned. We used to rely on them telling us what they need, right? And kind of just go in good faith, right? And then we would face issues like, we can put something up, but there is nobody to operate that specific equipment or that specific system. We are ready to hand over a project, but there's nobody ready to take it over from us, not realizing sometimes that actually the structure where you're planning to do all of this, that structure is probably going to collapse,
Neha, do
right?
you do a backward integration, like identify community people who have the acumen to do technical stuff? Can they do the operation and maintenance of your infrastructure? Has
No,
there been a
so I was
plan?
just coming to that. So now the thinking that we are thinking of, and we are still working on this, right, is to actually do it the other way around, right? Which is to say, I am going to identify an area where I want to make an impact, right? I'm going to identify a partner who can get me great government connect. Then I'm going to identify what are the needs, right? Take what a PHC should be as per government guidelines. So rather than them just coming with an itemized list, I actually do a full, like you said, a full back, ground analysis. Look at the capability of the doctors, the nurses, the ASHA workers, and what is that sort of, training gap that exists. And then draw up a model and say, this is what I'm going to do, right? So you kind of turn it on its head, right? Where we are hoping it is less prone to local pulls and pressures, which, say, a big company who is based out of Bangalore has a few people working on CSR, and of course has some great partners, but also has a limitation of not knowing what's really out there. So we want to do that work before and proactively design that program, right? Rather than the other way around, right? So that is the thinking. And we are also hoping to start doing some of that work from later this year.
How CGF Samhita can support doing a need gap analysis for you and design an intervention which can be co-created. We don't have
Yeah,
to.
absolutely. So we are absolutely open to that. I would say, this goes back to our learnings, and where we feel our CSR program going. So, you can imagine that, as a corporate that was doing volunteerism, right? But that is more about your own employees, right? That is not so much from the lens of what is the impact that it's creating. So I think, and this is my feedback from a lot of people I interact with externally as well, not from the legal world, from the CSR world, that they have also gone through the same journey that we are going through, which is first just putting in the money in what seemed like good programs, say maybe from 2018 to 2020. 2020 to 2021 was all about COVID, right? For a lot of people, right? And now people are kind of emerging out of that and saying, I don't want a fragmented CSR program, right? Because I look at my CSR programs, which have been running for 4 to 5 years. They are all great programs. So that's the beauty of CSR, right? Everything is a great cause, right? But the question is, should you really be putting what is a limited amount of money behind that cause? Can it be put somewhere else so that it has a larger impact? So the way we are looking at our CSR now is, one, let's not fragment the programs too much. Two, therefore, not look at the width, but really the depth of the programs, right? And three, make longer term commitments, right? So let's not look at programs just with a 1 year time frame, because there is no impact, and then say, okay, next year I will decide what to do, and maybe next year I'll go somewhere else. But really look at programs with that eye, that am I going to do this for the next 3 to 5 years, right? And what is going to be the impact at the end of 3 to 5 years? And we have been very open to ideas and remain very open to ideas from CGF as to what we could do in the healthcare space, which kind of ticks these boxes for us, right? In fact, one of the efforts which now CGF is also involved in as our partner is the WiproGE flagship that we kind of launched last year, which was with PATH, right? So PATH is very much working on the program where they're going to be strengthening district and block level laboratories, right, for community surveillance of diseases. But a very important aspect of that program is really community awareness. So unless you don't have people going back and talking to panchayats and communities about vector-borne diseases, for example, or NCDs, right, you will not be able to make that impact. So in fact, the original program that PATH had designed did not have this aspect of community surveillance. And I think with PATH's help and our own push, we said, we want to do it this way, not just set up the laboratories, but also go out there in the community, right? So, I mean, I'm super excited about that program. It's been 4 to 5 months since it's been launched. We intend and we hope that this will be a 3-year commitment. And we are very excited to see what the results of this could be.
So, what has been your roadmap, if I may ask you, for the next 3 years? In fact, currently, CGF Samhita is working on about 9 interventions with you. So, if you may want to pick up, I think we can't do all of them, right?
Yeah.
It will take a longer time.
Yeah.
If you want to pick 3 top on priority, what is that you would want to do?
Yeah, so very much you're absolutely right. So in fact, we have also been on this journey of consolidating, some of our programs, right? We also want to design programs in a way that, for example, we have been doing screen, for some time with PPHF, right? Which is about again capacity building of ASHA workers and screening of NCDs, right? But on the other hand, we also do upgradation of PHCs, right? So one of the key thinkings that we have been thinking about is, why don't we upgrade PHCs in a way where we say, okay, this year I'm going to upgrade the PHC. That is going to include capability building and training. And maybe for the next 2 years, for that very community, I will try and do screening, right? And build community awareness of diseases and hygiene, XYZ. Which goes back to the idea of, let's not go with width, but let's go with depth, so that you can truly make an impact on people's lives, right? That's really the North Star, right?
Yes.
So the way I see it going is, I see our programs getting more consolidated. I see and I hope there will be more collaboration between our partners, and I see CGF as, because of CGF's presence, right? Very few players bring the kind of pan-India presence and depth of experience. We are sort of hoping that CGF becomes that, platform to collaborate the strengths of our different partners to be able to run more cohesive programs, as opposed to, let me go do screen in, 6 districts of Karnataka and then let me go upgrade PHCs somewhere else altogether, right? But rather go for a more focused intervention where you can see results and say, the next 3 to 5 years. And as I said, make a difference in the lives of a community, right?